Sex therapy. Dr. Root's office. Dr. Root is waiting in her office, seated in one of the chairs, as Peter enters stage left.
Oh, hello. You must be Peter. I'm Dr. Root. You probably heard of me from my radio show, The Orgasmic Hour with Dr. Root.
Sorry, I'm not familiar with it.
Then how did you hear about me?
My parents referred me.
Oh, well, it's very, very important that you achieve an orgasm at least once a day. It's very, very good for your health. Twice a day, 3 times a day. The more, the better. Excuse me. I just had an orgasm. So tell me about yourself, Peter. What brings you here today?
I'm having a problem with intimacy. I can't get liftoff.
A lift-off?
The elevator isn't going up.
Oh, you mean you have ED?
ED?
Erectile dysfunction.
Yeah, that's the problem. I've already been through urology and neurology.
At such a young age, this is a bit unusual. I assume you tried Viagra or CLS?
Yeah, it didn't help.
What about hormone therapy?
Well, I was on testosterone and grew hair in places that I didn't think were possible. I was becoming the wolf man, but still sexually inept. They say I'm physically capable. They think the problem may be in my head. So that's why I'm here. 32 years old, and I just want to be a normal guy. I want to have a normal sex life. I want to meet the right girl. I want to father children. I want to have little limb dicks.
So your last name is Limdick? Peter, have you ever considered a name change?
No, why would you ask that?
Well, after all, you suffer from erectile dysfunction, and your name is Peter Limdick. Your name may be contributing to your problem.
I don't get the connection.
Your name may be giving you a subliminal message. People are calling you Limdick all the time, and that may be contributing to why you're going limp.
Doctor, I don't have a problem with my name. Limb dicks have fought in the war between the states and every war since then. I'm proud of my name, so let's move on.
Oh, I see I struck a nerve. First, I'd like to explain to you what I do. I am a psychotherapist, and I specialize in sexual dysfunction. Now, there are many types of dysfunction, and we treat it by both mental and physical therapy.
Really? How effective is that?
Sometimes we get immediate results right here on this waiting room.
Well, that may be a bit embarrassing.
No, it's a private room.
Doctor, may I interrupt you here? I have a question.
Yes, absolutely. What is it?
Well, is it true that sex therapists sometimes sleep with their clients? I mean, as part of their therapy?
Yeah, some of us act as sexual surrogates.
Well, you're like what, 90? And from what I read in magazines, you're not exactly what I was expecting. No offense.
Oh, I could still rock your world, but I don't sleep with my clients.
Whew, that's a relief.
I think we're getting a bit off track here. Let's get back and focus on your problem. Now, it's important for you to put your inhibitions aside and have trust in me for me to be able to help you. Also, please be as detailed as possible. Do you think you can do that for me?
Yes.
I promise nothing you say will ever leave this room. Everything will be kept completely confidential, okay?
Okay.
First, I would like to run some tests. I would like to show you some pictures. You tell me what you see.
Okay, now we're getting somewhere.
Okay.
I see a man and a woman having sex. I see see, ooh, two men having sex. I see two dogs having sex. I see a man and a woman in a threesome with a dog. Doctor, what the hell kind of test is this?
This is a raw shock test. I see you're obsessed with sex.
I'm obsessed with sex. I'm obsessed with sex. These are your pictures.
You have interesting results, but not conclusive. Tell me, what were your sexual urges like when you reached puberty?
Now those were my golden years. Despite being slipped a Viagra Mickey, all of a sudden I would have a poinsettia in my pants that would rise in the morning before I did and had a mind of its own.
That's perfectly normal. So when did things change?
Well, my problem started in college. When other guys were peaking, I was ebbing.
Can you recall any traumatic incident of sexual nature in college?
Not that I can remember.
I sense some resistance here. Something must have happened, and I think you're repressing it.
Well, there was an incident, but I don't like to talk about it. It was humiliating.
You must open up for me to be able to help you.
Okay. So, I went to a small Texas college on a baseball scholarship to play for the Mud Dogs.
Go on.
It was my rookie year.
Yeah?
I can remember it as clear as if it were yesterday. It was a late spring. It was my first game as a relief pitcher. The coach said, "Suit up, go out to the bullpen and be ready in case we need you." So I grabbed my stuff and I headed out there.
Go on.
Well, at first I thought it was just the heat of the day, but the more I sweat, the hotter I felt. And then it came on like a flash. I was on fire. Unbeknownst to me, my fellow teammates pranked me. They placed Ben Gay in my protective cup. I began running around in circles in the outfield, scooting my butt through the damp grass, trying to put the fire out. It was like a dog in heat howling, "Oh!" at the top of my lungs. The crowd and the bleachers thought I was leading a cheer, so they responded with, "Oh, go Mud Dogs!" I ran into the dugout and dove into the Gatorade tub to the roars of laughter from my teammates. That ended me up in TICU.
TICU?
Testicular Intensive Care Unit.
Well, that explains a lot.
But there's more, Doctor.
Yeah? Yeah?
I've never mentioned it to anyone before because I was afraid everyone would think I'm crazy.
I do crazy.
Have you ever been to a Willie Nelson concert?
No, I can't say I have, but what has that got to do with this?
Well, not too long after the game incident, Willie Nelson was doing a tour of the college campuses. So I bought a pair of concert tickets and I took my then girlfriend. And when it came to the part of the show where he began singing On the Road Again, I started to see an image.
Good, good, good. I think we're making progress here. What did you see?
I know this sounds crazy, but Willie Nelson looks a lot like a vagina, a big vagina.
I think we're having a breakthrough. Please continue.
And then he sang You're Always on My Mind. And from that moment on, something snapped in my head. After the show, my girlfriend and I went back to my place for an intimate moment. She started to undress, and all I could see was Willie Nelson. And my libido went right into the crapper. And it's been that way ever since. Women, no matter how beautiful, all I see is Willie Nelson. Doctor, I think I'm losing it.
You're not. A lot of people think Willie Nelson looks like a vagina. They even have a name for your symptoms. You have a case of the Willies, triggered off by post-traumatic stress syndrome. But that can't be the root cause of your problem. That is just a latent symptom. Your problem has to be more deep-rooted in your subconscious. Let me ask you this. When you do get aroused, do you ever see images of your mother?
My mother?
Yeah, you may have an Oedipus complex.
You have got to be kidding me. You think I want to have sex with my mother?
This is not as unusual as you might think. You may be harboring those feelings deep in your subconscious.
No. Just one thought of my mother would cause penile paralysis. But how does that explain that when back in the days when I could still have an erection, I felt severe pain?
That's because of your castration anxiety.
What do you mean?
Well, again, in your deep subconscious, you have a fear of being caught. Having sex with your mother by your father only cuts off your genitals.
Whoa. Let me get this straight. You're saying I want to have sex with my mother and my father wants to castrate me?
Yeah.
And the pain I'm feeling is brought on by the thought of my father cutting my privates off?
Yeah, that's correct.
There's a problem with that theory. You see, in the days when I could get it up, the images I saw were not of my mother. They were of my father.
Oh, that's because you're gay.
Does that explain the dreams I've had of seeing my father naked?
Well, maybe or maybe not. In those dreams, is your father very well endowed?
What do you mean?
Does your father have an overly large penis?
Now that you mention it, I think he does.
And what about you?
Me?
The size of your penis?
I guess it's maybe normal, maybe on the smaller side.
Oh, Peter, you have penis envy. You feel inferior because your father is well hung and you're not.
So, let me get this straight. According to you, I'm a gay guy who wants to bone his mother, but with a much larger penis, but I'm afraid to do so because my father will cut it off? Huh. I feel so much better now. I think I'm cured.
What makes you say that?
I have an erection.